So hi guys, hi, I am Dr. NGM, Dr. Njoku Clara Martins. Yeah, I am a medical doctor living in Nigeria, and I make YouTube videos to help individuals navigate the challenges of medical school and share the experiences of other medical students and doctors all over Nigeria as well. For now, we are here for now. You guys here, so you're very much welcome to my channel. If you're yet to subscribe, do well to subscribe. You're very welcome to the family here. And yeah, this is my second week of housemanship. Yay! Okay, so I'm done for today. So we had clinic. We saw plenty patients, a lot of patients. Actually, the patient-doctor ratio here is usually very terrible. You get to see lots of patients, too many patients, too many. So I did my first presentation today. So here is one quick area or one quick floor of the Nigerian medical healthcare system. We don't have enough doctors. But please don't read medicine here. But we don't have enough doctors. All the doctors we have are leaving the country. Yes, they are. They are going to some place or the other. It's really sick. Imagine us having a clinic and seeing almost 50 patients, like 4 consultants seeing almost 50 patients, and you have literally just 2 house officers in the unit, so you legit have to write drugs, investigation, all those things for all the patients. My bag is really heavy. I don't have a car, so yes, we walk, and the distance home is actually kind of far. So I have another presentation tomorrow. I need to present the x-ray of a patient, so I'm heading there now to get the patient's x-ray and maybe a little clinical data. So this is the para ward B. Good evening. Good evening. Para ward B. Do you think these things are working? Think again. This is me, the most beautiful doctor. Hi. And today also I'm making a presentation. I'm presenting an x-ray today. Only God knows how it's going to go. But yeah, wish me luck. Very cool drink after. So like this marks my second week in housemanship, and it's been very stressful. Yeah, doctor work ends easy, so but yeah, I've been pushing. Naturally, orthopedic unit is one of the busiest units, and I'm not just in orthopedic unit, I'm in orthopedic unit team B. So apparently here I'm doing housemanship where there are 2 teams in orthopedic units, but the team B literally has more work. Currently we have up to 15 patients in the ward, aside the one we see in clinic on a weekly basis, but team A legit has just 3 patients. 3 patients in the ward. Well, I don't know how they distribute their patients and all of that, but then yeah, it's just the way it is, literally. So what have I learned this past 2 weeks in housemanship? I've learned a lot, yeah. Giving drugs, giving IV medication, prescribing medications as well. Once again, seeing patients in clinic. I think I've practicing my clerking skills and all of that. I feel fulfilled. Yeah, I have so much joy actually doing the work, but then there's just this stress that comes with it. Too much stress, trust me, too much stress from having to be in the clinic all day, book patients, having to go for ward round. You have to do pre-consultant ward round, post-consultant ward round. Once again, just a lot. Trust me, it's been a lot. I can't even start to enumerate the things I've done this past couple weeks. Yeah, but my week started with making a presentation. Unfortunately, the surgery presentation for the week happened to be in our fall on our unit here, and I was the only house officer in the unit as at then, so legit I had to take the presentation. Apparently there was another house officer, but then probably he will take the next one if it falls under his unit. And we got to talk about principles of management of chronic osteomyelitis. And I would say it was a beautiful presentation. I would say it was a beautiful presentation. Obviously there will be comments, and you're not presenting just to orthopedic surgeons, you're presenting to everyone. There were comments, there were questions and all whatnot, but then I feel like it was fine. I don't feel anything went wrong. So we can only do better. So I thought that was it. I thought that was it for my presentation, but apparently the next day I had to present another x-ray. So in this center here, you get to present x-rays. That is, you get to present both the history, the presentation, what has been done, and then talk about the x-ray that you're presenting. You get both pre and post-op x-rays. So the case I presented was about SUFE. That's slipped capital femoral epiphysis in a 14-year-old, and they took a lot of time analyzing that. Took a lot of time, both the pre-op and post-op x-ray, and preparing for these things. If I had just the chance to prepare for these things alone, I wouldn't have an issue, but then having to still do the work you're doing, still prepare for these presentations as well, trust me, and having to wake up as early as possible to go there. You have to be punctual and all of that. So still very much draining. I think I'm having ulcer at this point because I've not been feeling well. But then we are where we are currently. So that's a beautiful month that just passed. So that's literally, and one of the other difficulties though is that I haven't gotten a permanent place to stay for 1 year. So not having a residence can be really frustrating. You get. Right now I feel like I'm very much disorganized, although it's not affecting my work, but then when you come back and then you're still not yet settled in, still not yet, like, you don't have a place of your own, you're literally squatting like a thief somewhere. Well, the place is comfortable, but then, having a place of your own, nothing big start, nothing top start. You get. So that's the latest updates. This week we had both presentations, normal clinic, normal rounds. And I think the patients keep increasing by the day. Today we have additional 4 people to give IV medications, and I think that's the burden of it all, to giving medications. Apparently today is Friday. Today is Friday, and there's Saturday and Sunday, but invariably you still have to come to clinic Saturday and Sunday to administer IV medication. I don't know why it's like that. Because in some areas there's still In some areas, people or nurses give the IV medication, but in this center, you give the IV medication. So you have to be punctual, you have to be there, you have to know that the patient requires these drugs and you offer it to them, yeah. And you're like the closest person to the patient. I don't know if you get, so yeah, you're like the closest person to the patient. That's legit how it is. So complaints, results of investigation, anything that is out, you have to let it be known to your senior chief, that kind of thing, yeah. You know how in my interviews, in my 43 questions, I actually did a series, for those of you that are not aware. I'm still doing the series though, so you see more beautiful things coming. You see more beautiful videos in the later day, yeah. So I did a series called 43 questions with a medical doctor, 43 questions with a health officer. And you know how in the series I was asking them, I asked them about what they do to, how do they handle stress and burnout and all of that. Well, I'm not yet burnt out, but then the stress is too much. So yesterday, I was just thinking to myself, so all these people have been telling me how they handle burnout and stress and all of that, and I'm here to figure it out for myself. You get? So sometimes, the past couple of days, whenever I feel like I'm too stressed, just lay down on the bed and do absolutely nothing. And I think it helps, even if I'm not able to sleep and all of that, I think it helps. Do you get? I think it helps. Another very challenging thing I feel, or I think there is the distance. So apparently, the apartment I'm staying at is inside the hospital, but then you have to walk a certain distance to get to the actual hospital. Do you get? It's not as close as people think. Do you get? It's not as close as people think. No matter what, trust me, it's not as close as people think. Because you have to walk and you have to carry your school bag and all of that down to the place and then come back again. It's not easy. It's not easy. But then the roads are beautiful, and then, well, I don't know, but we are doing it actually. Doing it. And sometimes when you're required to, maybe you're on call and all of that, the call rooms are not so conducive, trust me. But then when you're required to be around the emergency building and all of that, you have to walk all the way. Do you get? Or you just stay in the accident and emergency section until maybe you're required, and then after you're done with what you want to do, if you still have the chance to go home, then you go home and all of that. But then I don't know, it's actually very stressful. You get? It's very stressful, but we can't complain. Can't complain. My second week of housemanship, well, I would say that now there are little details here. Before I get to the conclusion of the whole matter, there are little details here that I feel like the healthcare system in Nigeria are seriously fumbling at. You get very little details, and even the big ones too, they are not actually doing as much as they possibly can. You get? The healthcare system here is terrible. So apparently we are still dealing or working with the paper system. We haven't fully integrated into the computer system as you have in the United Kingdom and every other very beautiful places. You get here? So so I walk into the accident and emergency department and I want to document for a patient. And I ask, it's usually kept, the papers are usually kept in a particular place, obviously. So, and the nurses are usually the ones in charge of it. So I asked one of the nurses, please, are there continuation sheets? And she says no. And I go into the nurse's room and I ask, are there continuation sheets? And they say no. Do you get? So what am I expected to use to document for patients? You know how when I was still doing my house job, a lot of people were saying, pack continuation sheets and put in your bag, or pack continuation sheets and put in your bag. I didn't take it very seriously because I thought, oh, why would a hospital be lacking something as simple as continuation sheets? Do you get? Like, why? It didn't make sense to me. But then here I am. Anywhere I see continuation sheets, I pack it, I'll put it inside my school bag, because sometimes you might actually be in a haste and you may need to want to document something for a patient. You can't be running around looking for continuation sheets everywhere. Do you get? It's not ideal. Do you understand? So yeah, just have them in your bag, and then whenever you need one, you just bring it out and document whatever it is you want to document. Because if you're waiting to have even prescription sheets and investigation sheets, do you understand, those things are not always seen. So sometimes you have to tear paper or something like, I don't know, it's maybe to me, but then I know that's like the minor thing to be concerned about, you get. But then there are other things. For instance, now you want to get materials for surgery. So naturally, we write materials or write the list of materials somebody needs for surgery and give to the person to purchase. Do you get? And the person have to go outside of the hospital to get those things. So imagine you have an emergency and these things are not available. What would you do? Like, what would be your fate? Do you understand? So I don't know. So apparently a patient actually brought it up. Apparently he hasn't been in Nigeria for the longest time, so he literally just came in and all of that, and it was a shock to him. It was actually a shock to him, because he was telling us that these things are not available, so how am I going to be able to afford this, or how am I going to be able to get these things for the surgery? If this is like, how will the surgery go on? Like, he was so confused, and I understand where he's coming from, because you don't tell a patient, it's not the patient's responsibility to get those things, it's the hospital's responsibility to have those things. Then after that, you bill the patient. But then it's just funny and it's crazy at the same time. But then, and if you keep, I don't know, and it's not a problem anymore. It's not like something that is a concern to as much people, but to me, it's a huge issue, because like, maybe I'm not so used to the system yet, maybe I'm not so used to it, but then these are little things I feel like could make a difference, and there's a way Nigerians are, there's a way we are. Maybe in the next 10 years, if you ask me, I'll probably get used to these things as well, but then a lot of people have now developed thick skin, like they don't know what is the normal anymore. If you take the Nigerians that have been here for 20 years, practicing here in this system of health, in this whole Nigerian healthcare system, to maybe a different place, trust me, they would struggle to cope, because they would struggle to cope. And they would be so amazed at the level of organization and all of that happens in some developed place. I'm not comparing, but then, well, these are things that should be available. Do you understand? Well, here I am ranting about the Nigerian healthcare system, but then I feel, I will just keep pointing it out at every video I make, literally. Maybe you've noticed something like that. I legit want to know your experiences. Obviously, I don't think the experiences of me or my experiences here are the same with your experiences, I want to know, what are those little things that aches you, in the course of your housemanship. If you're still a medical student, what are those things that aches you whenever you go for rotations, you go for ward rounds? What are those things that aches you whenever you're in the clinic? One thing I'll give this center kudos for, is having a consulting complex. Like, they legit have a big building, even if maybe there are cracks on the wall and all of that, but then they legit have a big building that is properly organized. You walk into a room and then your consultant these are my consulting days, so you walk into a room and you see the person you want to see, and you close, there's a door, you close the door. And you have this private time to actually discuss with your consultant. some places like where I schooled, well, they are dull, but then the environment, the nature, sometimes you don't even have light, you get, and you have to consult in the heat, and you have medical students scouting, pushing themselves through the door. What's like, what on earth is that? What on earth? But here you have that, you get, and yeah, I commend them for it. I commend them. And there's a way the buildings are here. The one consulting room can be linked to the other, so immediately you walk through the door, you can go through the back and all that. It's a beautiful setup. That's just what I'm trying to say. You get, maybe in your place there is that, you get, but then in some other places it's a luxury. It's actually a luxury. So I want to know, what are those things that aches you in your teaching hospital or in the hospital where you're doing your rotation? What are those little things you get that, I don't know, that you feel maybe are normal in the Nigerian healthcare system, but they shouldn't be? You get, they shouldn't be. Yeah. And maybe if there are places to where I feel the healthcare system here is doing all right, I will point it out as well. Let's not be a little bit too much on the negative, you get, but I don't know, that's my experience so far. And I still have 1 more week to go in orthopedics, yeah, and I pray it becomes, or it's as uneventful because, wow, I don't know. Imagine just starting house job and you're in one of the toughest units ever. Oh, hi. So I'm not scared about it, yeah, but it's one of those beautiful places. They repair bones. They're like I call them like the carpenters of medicine, because they don't even hammer and screw. But yeah, I work with some very understanding people. Yeah, and they are good at what they do. They are good at what they do, and I don't know, I'm just opportuned to be working with them. Do you understand? And sometimes when you come for theater and all of that, it's just a flow to work. Do you understand? It's just this flow to work sometimes. And I appreciate that. I like that. So that's that. I think that sums up my week literally. Going to work, coming back literally, and going to work very early, coming back literally very late. I hope the 3rd week is uneventful. Like I said, I hope it is uneventful. I hope it is peaceful, it just goes on smoothly, and I get to finish this unit in peace. Yeah, and I don't know, hopefully in my next video I'll tell you guys the units I'm going into. Yeah, that's just it. Pray for me to survive this house job. And one thing I don't fail to do is to disappear, to go and eat whenever I can, because if you stay here to be doing, hey, I'm very diligent, workload, blah blah blah, I don't have time to eat, who are you doing? Like, there's something they said on the day of our induction. Yeah, they made us pledge to take care of ourselves, because legit, if you don't take care of yourself, how do you want to take care of the patients? How do you get? So yeah, if you're yet to subscribe to my channel, this is a very beautiful opportunity for you to do so. Please do so. Yeah, and yeah, I would keep sharing information, tips to help you grow in medical school. Yeah, so NGM here. I'll catch you guys in the next one.